Hi, and thank you so much for joining us. I'm Megan Finnerty, and I'm with USA Today, and I'm your host of Coronavirus Conversations, part of Just the Facts Live. I'm here at home in Phoenix as usual, and this show is here because we know facts fight fear, and we're here to do it with more than 5,000 journalists from across the USA Today network. We want to answer your key questions, keep you informed, and bring you some comfort. We're here to talk to each other, not over each other, and speak with you. So, I'm excited to get into today's show because reporters and experts from across the country and the USA Today Network are here to help. First, we have Jessica Menton from USA Today on how the CARE Act is going to impact your mortgage. Deborah Berry from USA Today is here on how coronavirus is disproportionately impacting communities of color. Hi, Deborah. Thanks for being here. Ashley Balcerzak from NorthJersey.com is here to help us decode all the graphs and charts we're seeing these days and talk about where to get good data or good information. Thanks for being here, Ashley. What things are like in Florida from Hannah Mortz from the Palm Beach Post. We hear so much about Florida man. Now we're hearing about Florida, the state, and Hannah's here to chat with us about what's going on down there. And we're going to also talk to our colleague David Kender from Reviewed.com about where you can still find the essentials you need. Hey, Dave, thanks for being here. We're going to start talking right now about money and mortgages with Jessica Menton because we have gotten so many questions from you about the CARES Act and how it's going to impact your ability to stay in your home. Jessica, thanks for being here today. First, how is the CARES Act impacting mortgages? Like, what's supposed to be happening?
So it's definitely been a very confusing process for a lot of homeowners in recent weeks that have unfortunately been laid off or if they've been furloughed due to the coronavirus crisis because the relief options have been rapidly changing. So here's what you do know when it comes to the CARES Act. There's two main forms of relief for homeowners right now. And the first thing is that it prevents lenders from beginning any sort of foreclosure proceedings on any federally backed loans for at least 60 days from mid-March. And then the second big thing is that homeowners who've experienced any sort of financial hardships from this can request a forbearance for up to 180 days. And then if they still have any sort of financial strains after that, they can request another additional 6 months after that. But the bottom line is when it comes to a lot of these relief options for borrowers, it really depends on the type of loan that you do have and whether or not it's federally backed.
That is so interesting. So I know a lot of people have been contacting us because the first thing everyone did like 2 weeks ago or 3 weeks ago was they called their banks and they called their lenders and they said like, hey, here's my situation. And I know a lot of our viewers have been hearing, this seems to be really common. Hey, you can put off paying for 3 months, but then at the end of that 3 months, you'll owe all of that money at once plus the next month's due. Talk to me about like, this just seems like so much stressful confusion between banks and the CARES Act.
Exactly. And I think that has shocked a lot of different borrowers who I've talked to. And I've talked to you about different stories that I've done as far as what they've faced through this. And I think the biggest thing is when it comes to this 90-day suspension, this isn't in the CARES Act. This was previous guidance from different regulators. Say if your loan was, for instance, if you had a loan through Wells Fargo, Chase, or Bank of America, but they were servicing the loan through either, say, Freddie Mae, Fannie Mac, FHA, or VA. And this 90-day suspension actually encompasses former, say, natural disasters. If there was a hurricane, for instance, they would use 90 days because they would know whether or not someone could get into their home within those 3-month time frame. Whereas this is a very different type of crisis, right? I mean, most of us are stuck in our homes, so we know if we can get into our home. So they're starting to realize that these previous guidances that they did have don't exactly work for this type of situation because it is a completely different crisis. So I think the big thing is you really need to know who backs your loan. Is your loan directly owned by the bank or is it serviced and it's actually backed by Fannie Mae or Freddie Mac or other government entities?
So what should people do right now? Because I know they were calling their banks and now I'm sure they're like Googling CARES Act mortgage, they're watching the show. What's your advice to people like right this minute if they're anxious about their mortgage?
It's definitely a fluid situation and you should be prepared to be on the phone for a while because there's a lot of homeowners that are looking out for different sorts of relief options. So I think the first thing is know that it might take some time to get in contact with them. But also once you're on the phone with them, you really need to ask for specific details as far as what kind of relief options are available to you. How can you temporarily reduce those payments or suspend those payments, and also be sure to ask how long that is. So say, for instance, if it is 90 days, you would want to ask, okay, For instance, would I need to pay the 3-month lump sum on day 91, or can I do some sort of loan remodification after that, or even have another round of forbearance after that? And then I think another big thing is asking if they could waive any sort of fees associated with it. And then lastly, I think that any sort of communication that you do have with your lender, you should keep it all in writing. And any sort of phone conversations you have with them, you can send them a letter saying, hey, I talked to this representative at this time. This is what we spoke about. Ask for a confirmation number, because you can't really rely on every sort of representative from the bank to actually keep a document of these things. And so it's for your best interest to keep all of it documented and even take photocopies just for your records, so that if later on down the line you're talking to another representative and they want to offer you something else, you can go back to that and you can say, well, this is what I talked about from the beginning and this is what I want.
Oh my gosh, you know what this sounds like? This sounds like dealing with insurance companies right now, like how we think about how to deal with medical billing and things like that, which is so crazy because for so many people, if you have a mortgage, you have it automatically deducted from your bank account and you're really not engaging with it on like a daily basis in a perfect world. So, well, thank you so much for being on. I think these are it's really stressful conversations to be having. And I know that we wish we could provide more clarity. So Jessica, we're going to have you on for the rest of the show. We want to invite you to stick around, but we want our viewers to know we're going to keep writing stories about this and figuring out like what can you do and how can you push back and how can you better negotiate. So keep staying with USA Today because we have so many reporters on this right now. And if you find these kinds of conversations helpful, we hope that you will share and like our show because your friends probably are asking the same questions. And you can let them know, hey, USA Today helped you figure this out the other day. So thanks for that. I want to bring up our colleague Dave Kender from Reviewed because he's here to talk to us about all the stuff we still need. Dave, I want to start with, we're still seeing some panic buying. Like people are going through key items so quickly. Talk to us now that we're 4 weeks into this. Like, what are you seeing?
4 weeks, it feels like 4 months.
I know, God bless.
But yeah, we are absolutely still seeing, I don't know if you call it panic buying still. It's whatever the word we want to choose for the next wave is, but there's definitely shortages. And some of the items that were unavailable right at the beginning, like masks and gloves and hand sanitizer, continue to be really challenging for people to find. That list has evolved over time, and it hasn't gotten shorter. It's definitely gotten a little bit longer. There are certainly grocery items that can be difficult depending on what region you're in, milk, eggs, flour, things like that. But nationally, we're seeing difficulty finding certain kinds of laptops or more affordable laptops because you have a lot of people working from home and parents who need to have laptops to help with their kids' education. We're seeing a run on webcams. We're seeing runs on diapers, things like that. So items that were not in short supply a month ago, and certainly we're not in short supply 2 months ago.
Dave, that's so interesting. You know, we were talking earlier, your website is updated 2 or 3 times a day for this particular URL that we've been sharing, but it's at usatoday.com. If you type in, where to buy sold out household essentials, talk to us about how your team is staying on top of the, like, where can you find it?
So normally we have a part of our team who just hunts deals. They do deal surveillance on the products that we love, the products that we're testing in our labs. And we absolutely love, we're going to help readers find when they're on sale. What we've done in this new modern coronavirus era is shift that team to largely just looking for where to find those hard to find essentials. All of those items that I mentioned, plus things that we're seeing popping up that are on sale. There's been a lot of interesting deals for things that don't ship, like Masterclass, for example. Now, if
yes,
you have time,
buy one, share one, I saw.
Absolutely, yeah. Or maybe now's the time you want to learn a second language or things like that. So we're finding some fun things that are on sale that if you have a little bit of time and a little bit of extra money, they could be worth your while. But a lot of our team's time is dedicated to finding the hand sanitizers, toilet paper, paper towels, things like that, because they come in and out of stock so quickly that we're actually updating those articles 2 to 3 times a day at this point.
It's amazing. I so appreciate all the hard work your team is doing. You know, we're sharing this link. And so I know if you've clicked on the first, because you're also trying to share a bunch of links for each item too, right? Like if one kind of soap is out, you're saying try these 3 other kinds of soap. So we really appreciate that. I do want to ask you, as we keep talking here today, We talked about hand sanitizer for a second, and we were talking about hand sanitizer on day one. I know you have a story about where you can still find it that you're updating constantly, but you also still have one on where you can find the ingredients for it. Talk to us about that reporting and how that story is looking these days.
So it's pretty easy to make your own hand sanitizer. It's really just 2 ingredients, maybe 3 if you want to add some essential oils. It's the isopropyl alcohol or isopropyl alcohol that needs to be up above a certain percentage of total volume is what CDC recommends. So you need to be careful if in your ratios of the alcohol to aloe vera gel is what most people are adding it with. And then, as I said, you can add some essential oils if you want an extra scent or something like that. CDC recommends that you need to keep the overall alcohol percentage at 60% or above, say 60 to 70%, in order to effectively kill coronavirus. And you also need to use a decent amount of it. You want to pour it onto your hands liberally and really rub it in for a while. It can be as effective as washing your hands if used properly, but a lot of people aren't using it properly. They're either not spending enough time rubbing it in or they're not using enough. So the go-to recommendation is always going to be to wash your hands really well. Unfortunately, you can find soap.
Right. I appreciate that. I was wondering when deep moisturizing hand lotion is going to be on your list of things that you can't find anymore because we've all been dumping alcohol and so much soap on our hands. Mine are, they're not as soft as they used to be. But Dave, listen, we're going to keep you on the show, but continue to thank your colleagues. I know they're working really hard to help us find the things we need. So stay on the show and we're going to keep chatting. Thanks for being here. We're going to go to our colleague, Ashley Balcerzak of NorthJersey.com, because she has been reporting on tons of news, but tons of news that involves graphs and charts. So Ashley, thanks so much for being on with us. I want to open with the idea of, I'm just going to admit this, the last time I took a statistics course was easily in high school. And I don't know how old I look, but that was a while ago. So with that, Ashley, first, how do you know which graphs to trust? So much of our journalism right now is based on numbers.
Yeah, so a lot of the graphs that I've been reporting on and charts have to do with daily numbers and modeling. So that's the chart that you're looking at right here. A lot of different scientists and universities are kind of coming up with these different models for certain aims. So like this graph, for instance, is based on the CHIME model that was developed by Penn Medicine. And that's basically for hospitals to understand, do they have enough equipment? Do they have enough ICU beds? Do they have enough ventilators to be able to determine that? So a lot of times you'll see your local health official or your state health official showing these to say, okay, this is how prepared we are. This is when we expect to see a huge surge in patients.
So if you want to talk about this briefly, we've been hearing so much about the greater New York region and the Northeast. Do you want to talk about what these graphs are illustrating for us right now?
Sure. So these are 2 models that we were shown last week. So they are a little bit outdated. And that's another thing you should all keep in mind. You should understand when a model was run because these things are changing every single day. Like health officials should be looking at them, running them multiple times a week. So this was kind of to show the public this is how important social distancing is. So our governor, Phil Murphy of New Jersey, was saying, look, okay, this graph on the left is showing you no social distancing. Everybody is going about their life. There is no change. Basically, we could have seen 80,000 people hospitalized at one time. We would have run out of ICU beds April 1st. We would have run out of all ICU all beds in general by April 9th. So that's a very terrifying picture. On the right, you see if we have social distancing of 31% compliance. We asked where that came from. They said that that's like a historical point with past pandemics. So they're hoping that we're a little bit better than that, but just there. And you see that curve being lowered when you keep hearing, oh, lower the curve, put the curve down. This is kind of what that would look like. So it's pushed out the amount of time that it'll take. You see lower hospitalizations, you see lower ICU usage, and you see that we're also trying to get new beds, more ICU beds. So it was kind of to show, look, social distancing is really important, you guys, and this is how our hospitals will be able to deal with that if we actually comply with the measures.
I think that's so interesting, especially too, that they were modeling 31%. Like they have really low, like they're basically saying 70% of you are ignoring us and we know it. So, okay, God bless. I do want to ask you, see how that little icon in the corner says New Jersey? It says NJ there. And you mentioned a date. You also mentioned like where you got this. For our viewers, I think there's a couple key takeaways here. Like if you're looking at a graph and there's no date and there's no source at the bottom, even in fine print, or if somebody, here's one I saw the other day, somebody had like drawn on it with like an internet pen circling something.
Yeah, not a good
sign. No, right? Like if it's altered in any way you can see, like news organizations aren't going to draw on something with an internet pen.
Exactly. I mean,
sorry, it's called a stylist.
Yeah. Use your news literacy skills. It should be coming from either your local health department or state health department or a news outlet that you trust. And hopefully the news outlet is explaining to you exactly where it's coming from. Sometimes you're going to see combinations of models, which is actually preferred. It also is important that this model is not saying this is definitely going to happen, because again, everything is changing very rapidly and there's just so much that we don't know that is really critical to what the model shows us. Like we do not have widespread testing. In New Jersey, we are only testing symptomatic people. So we don't have that denominator there, which wildly can change these graphs. So just going into it and understanding what this is trying to accomplish, what the downfalls are, what our assumptions are. So one of those, I think the first graph that you showed, it showed the assumptions there. It was like 0 social distancing. We think that 5% of the people who are in the hospital are going to be hospitalized, 2% of that ICU. So just understanding the inputs into it is very, very helpful.
I really appreciate you pointing that out, because when we are trying to receive information visually like this and we're all in a hurry, I think it can feel really overwhelming, which kind of gets us to our last question. You hear about information fatigue, and now that we're 4 weeks into sort of like an alert state, the data, as you mentioned, keeps changing. The recommendations keep changing. I know people are starting to say things like, well, I'm just going to tune it out. Like, I don't know who to trust. And what do you have to say? I mean, help us understand like how to respond to those feelings.
Sure, and that's totally understandable. Just a lot of these models, again, are really important for hospital administrators, for instance, or showing you staying home is really working. So maybe you don't want to check this every single day because it will fluctuate, but just to understand, this is why we need to do the social distancing, right? And it will change as more people follow through, as we get more hospitalization or case numbers. So it will be shifting over time, and you should expect that.
I think I really appreciate that. I always try to tell people, because I work in the media and people ask like, oh, and I'm like, you don't need to be on the news 24 hours a day. You might want to check in like once a day, or have specific times where you check in. Or my husband and I made a rule that you can't talk about the news in our bedroom, and you can't bring your phone in and like look at the news, because you just have to have a physical space where like I'm not leaning over and being like, look at this terrifying chart. So Ashley, sorry, maybe that was an overshare, but I'm trying to practice good self-care here and model it for other people. Ashley, thank you so much for being on. We want you to stay on, especially because we're going to be talking some more about where we're seeing outbreaks and how we're tracking this virus. So I appreciate you being with us. Stay with us. I'm excited to bring on Hannah Morse. Hannah's she's the Palm Beach County reporter, and we are excited to hear from her because we've heard a lot about Florida over the last few days as one of the states, including, I think, like Oklahoma, Georgia, that's had a lot of conflicting advice to its citizens, and maybe has not been enforcing social distancing as aggressively. First, my question is like, how's it going in Florida right now? Like, what's happening there?
Yeah, so Florida is now under a stay-at-home order that happened last week, which marked about a month since the state recorded its first positive case of coronavirus, which that caused confusion. That order caused some confusion for the cities and counties that had already implemented their own restrictions. They didn't know if that meant their restrictions were totally wiped out or anything like that. Governor Ron DeSantis later clarified that this order was just a standard baseline, and that local governments could implement their own restrictions.
Are beaches closed like city to city, or is it statewide? Are they all open? Can you help clarify that?
So they are closed, at least in Palm Beach County, Broward County. That has been ordered by the governor, and previously the social distancing guidelines were really asked to be followed for beaches, because we've all seen the pictures of the spring breakers who were crowding the beaches. So now if you go on a beach in Broward County, some other counties across Florida, you'll probably be stopped by a law enforcement officer saying that you shouldn't be on the beach right now.
Okay, that's interesting. We want to know, are people in Florida do you feel like people are taking this seriously? Are people still going to church, we're hearing, and like gathering in places? Or do you think that's just like that was this one church, or it's not as common as it sounds?
Yeah, so for the most part, people are taking this seriously. The governor shut down bars, clubs, and restaurant dining rooms a little bit more than 2 weeks ago. And like I said, like people are unhappy about the beach closures, but it's a necessary thing to do to keep people from gathering. And yeah, so the governor also said that going to a religious service was considered an essential service. Then he later clarified that everyone should be, again, maintaining a 6 feet distance, social distancing. But a lot of the churches here, for the most part, have been already starting live stream services or even drive-through services. And the few that aren't are being asked to like keep parishioners separated or have smaller gatherings, but really the message is to stay at home here. And also another thing that people are not happy about, especially in Palm Beach County, are golf course closures, especially the South Florida counties, Miami-Dade, Broward, Palm Beach, both private and public golf courses have closed. So local officials have been getting a lot of angry emails about that.
You know, that's in Arizona, it was the same thing. Like some were open, it depended on the city, and that the governor, because it's not a shelter in place order, it's not as strict as what's happening in California, which I think is, or Illinois. And at first people were like, oh, you should be allowed to golf, you're outside anyway. And then you're like, no, people work at the golf course though. Like you're interacting with people, and oh my gosh. Well, Hannah, thank you for walking us through what things are like in Florida right now, because we have heard a lot about it. And I think it's kind of one in a group of states where things don't seem to be as like urgent yet. And the weather's beautiful, and a lot of Americans have vacationed there. So, you know, I don't know, we think of Florida as like a place to go to the beaches. And it's good to hear people are taking things a little more seriously now.
Yeah.
Thanks so much for being on. We're going to go now to Deborah Berry. She's our colleague at USA Today who's been tracking the unequal impact of the coronavirus on communities of color. Deborah, thanks so much for being with us. My first question is, first, like, how is it affecting minority groups? You had a story come out this weekend, last week.
Right. And actually, it was a story a couple of weeks ago where we talked to a lot of experts about what kind of impact this might have on people of color. And much of them talked about, while every population is vulnerable, of course, what is particular about people of color is they're disproportionately impacted by some underlying health conditions, asthma, diabetes, heart disease, all those things that make them particularly vulnerable to the complications of coronavirus. So it's been a really tough situation.
Yeah, there's new data coming out right now. We saw some stories out of the South and Chicago. Can you talk about what people are hearing early impacts are?
Sure. Some of the stories, actually, we're working on a story that's going to be published later today or early tomorrow about while people have warned or have been concerned about the impact, now we're seeing where it's kind of playing out in some places. For example, Louisiana, they released some stats that showed that 70% of the people who died from corona-related virus are African Americans. And that's in a state where the population is 32% African Americans. So it shows there an example. Some of the major cities that are hardest hit by it, New York, Louisiana, Detroit, are cities that have a significant Black population. So while there were concerns about it and alarms raised about it, it's kind of showing up in some of the places that are actually releasing data, keeping in mind that a lot of places still aren't or haven't released data.
Yeah, that brings, I want to bring up our colleague, Ashley. She was talking for a minute about how are we tracking the virus according to ethnic identity, and it seems to vary from community to community.
Yeah, from what I understand, there aren't a lot of states that have been releasing that. In New Jersey, they just started giving that data yesterday, and it's still pretty broad. I think we got Black, white, other, and Asian. So we don't know the Hispanic breakdown, and we only knew 50% of the cases. And these were of deaths, so we don't even know the cases at this point. So it looks like we're just kind of starting to get a snippet of that, at least where I cover the coronavirus news. So it'll be interesting to see if more states start disclosing that data.
Deborah, you were saying, oh, sorry, go ahead. I was just going to toss to you. Go ahead.
I was going to follow up with that is that there is a call now, and there's been a call before. Representative Robin Kelly of Illinois, for example, she's chairwoman of the Brain Trust for the Congressional Black Caucus. She and others, some members of Congress, have written letters to CDC and the HHS secretary, and even more recently, as of today, the NAACP and other groups have also raised alarm, calling for all these groups, for the federal health officials to release data, but they're also calling for states individually to do it because they're talking about how important it is to have that data so they know how to respond. So health officials, state officials know how to respond and where to direct resources.
And it just sounds like that's happening at a really slow pace, if it's happening at all.
Right.
I want to ask you, Deborah, your story talked also about how minority workers are being impacted by this in particular. Can you speak to that?
Sure. And many of the service industry jobs, they're disproportionately filled by people of color. And that includes some of the people who are going to work now. That would be the bus drivers, the people in transportation, the home health care folks. So those folks are vulnerable. Well, one, they're people of color in those health conditions, but they're also vulnerable because they're exposed or could be exposed. They are exposed, and sometimes they're exposing their families. So there's a lot of ways where people of community are impacted both economically, both by the health disparities that already exist in our country. And so that's why a lot of these groups, civil rights groups, advocates, community groups, are raising alarm to please pay attention to these communities who are already marginalized in many ways and who are particularly vulnerable.
It sounds incredibly scary. So I'm going to ask one question that might have some good news to it, but I want to say, like, what's being done to support at-risk communities?
Well, one of those things these groups calling for all this attention, or trying to bring attention to the needs of this community, calling for the racial data. Some groups have long before the coronavirus have been stepping up to try to address disparities, especially healthcare disparities, particularly faith leaders, churches. I did a story maybe a year ago about all these religious leaders having this big conference in the church to talk about how they can do things in their church, whether it be stop serving fried chicken on Sundays, whether it be to turn the parking lot into a track so that folks could walk around. So groups have been stepping up along the way to do this anyway. But I think now the sense of urgency is obviously right in your face, because the virus is affecting every community, and particularly the poor and the minority communities.
Deborah, I really appreciate your reporting, and I also am going to ask you to chat with me for a second. You did mention faith community specifically as being both aware of the problem and working to solve it long before this happened. I mean, I know when Deborah and I were chatting about this segment before now, I said, like, oh, essentially her story is about institutional racism and long time effects of unequal treatment and unequal resources that this happens every time there's a crisis, is the most vulnerable in our communities that are impacted the most dramatically. But we're going to finish our show by reflecting on the fact that this week is Holy Week, and it's Passover. So it's a time when two of America's larger religious communities would typically be getting together. Deborah, you mentioned what you and your family have been doing in absence of being able to attend Sunday service. Tell me a little about that.
Sure. So we go to a church down the street around the corner. Of course, with this happening, we can't go. So what we've been doing is we literally gather in our little family room, my husband and my daughter, and we watch our pastor on Facebook Live. So we're missing some of the rituals, the singing, the communion, all those other things, but we're still hearing the word. And as we're sitting in our living room together, having church. It may not be in the traditional building, but we still are having church. And actually, in some cases, some of my friends, my best friends, my family, they're sending links to their pastor. So we're all kind of watching each other's church and visiting other churches along the way. So it's been kind of cool to hear the message from other places.
I genuinely appreciate that. I know for my family, we also would typically, especially during Holy Week, there's all kinds of there's holy days of obligation and lots of things that we would normally be doing right now, like Stations of the Cloth and Good Friday. you say Black Friday because it's actually like a very depressing service, guys. If you're not Catholic, it's like pretty depressing. But I really like it because it connects you deeply to the sort of the heart of the faith tradition that I'm part of, which is I'm Catholic. And so, Deborah, thank you for sharing. Thank you for sharing a little bit about your faith and how you guys are staying together right now. To all of our viewers, I want to offer you guys this thought that right now, people who are of the Jewish and Christian faiths are getting ready to celebrate some of their most important holidays in their calendar year. And later this month, our Muslim neighbors will celebrate Ramadan. And in every case, these are holidays that are focused in some way on a renewal. And that's something I hope that many of us are connecting to right now. Everyone at the USA Today Network is focused on supporting you in your journey of survival and renewal right now. We understand that these times are difficult and that many of you are leaning on your faith. We are a social species, all of us humans, and we're here to thrive on love and community. And so whatever your faith or your spiritual leaning, we hope that this week is able to offer you moments of grace and resolve and inspiration and renewal, wherever you do that. We really appreciate you tuning in, and we are looking out for you. Our next show will be on Tuesday of next week. We're coming to you again later in the day now. We appreciate you staying connected with us through usatoday.com/news coronavirus, or you can stay with us here on facebook.com/USA Today or instagram.com/USA Today. I want to thank my guests again, Deborah, Hannah, David, Ashley, and Jessica, for helping keep us connected and informed. And I'd like to thank you for watching. Have a good one.
Hey, thanks for watching. If you like this video, check out these other videos from USA Today to stay up to date with all the latest news.